Good afternoon. How is everyone doing? This is one of the most exciting sessions. So I hope you all had nice lunch and let's get started. This conversation is about our DNA, the art of giving. And today, I am honored to present three panelists, three business tycoons, so humble with their humility, how they have brought transformation in themselves, and now they are ready to transform the globe. I will request our panelists to please self-introduce briefly.
I'm Ajay Piramal. We have a foundation which is in India called Piramal Foundation. Today it is, in terms of operating on the ground, perhaps one of the largest in India, where we have 5,000 full-time employees working with us. We are working in 28 states in the country and work in partnership with government and touching about 120 million lives today in the space of education, health, water, and livelihood improvement.
Excuse me. I'm Sunil Wadhwani. I'm based in the US, in Pittsburgh. I went to Carnegie Mellon University many years ago, never left Pittsburgh. And in the US, I've started several different companies. And about 30 years ago, when I was taking one of my companies public, it occurred to me how fortunate I was. I was born in Delhi at a time when 90% of the population of India was low income, couldn't speak English, but I was fortunate to be born into a middle-class family. Parents believed in education, studied. They sent me to a good school, which got me to IIT, which got me to Carnegie Mellon, which enabled me to start companies. So I said, I could have been born a quarter mile away in a slum. Life would have been very, very different. So ever since then, 30 years back, I've been involved with the social sector in India, working with different NGOs. About 10 years ago, I started my own NGO in India in the public health space. And we work with multiple state governments. We do on a smaller scale what Ajay is doing through Piramal Foundation on a much larger scale. We run about 1,200 clinics in low-income communities around India, feeding over 10 million people a year with free healthcare. Then about 5 years ago, I started a second nonprofit foundation in India, focused on applying artificial intelligence for social development. At that point, I'd had the privilege of serving on Carnegie Mellon's board of trustees. And Carnegie Mellon is one of the global leaders in AI, research and teaching. So I got to see firsthand the power of AI, but I also got to see firsthand that it was being applied only for commercial applications. So I spoke to my brother, and we started an AI institute here in India, a nonprofit. Prime Minister Modi came to inaugurate that. And we now have over 300 full-time employees over there, AI machine learning experts, developing applications in healthcare, education, and agriculture. And then finally, last year, I launched a school of AI at IIT Madras, which is my alma mater. And in a few months, I believe it's become the largest school of AI in India, with about 70 faculty and about 400 students.
Hi, I'm Bharat Desai. Grew up in Kenya, lived in India during high school and college, and live in the US now. We have a foundation that focuses largely on education and entrepreneurship. These are two areas that significantly changed my wife and my lives and our family's lives, and we feel passionate about how we can impact lives of others. So we have programs with the University of Michigan, with IIT Bombay, with some government school districts that we adopted in Gujarat. which we can talk about.
Thank you. Ajay, you have talked about transforming yourself with your journey of philanthropy. Please share with us, and what I really attracted me was system change. Most of the time, we give, but no one looks at the system. If the system is broken, the results will be broken. So please explain.
Yeah, I just want to start because I really like the title of this whole seminar, the DNA of the Indian diaspora. I think it is so unique, our DNA, and I think all of us share it. You heard both Sunil and Bharat say something which was really common amongst, I think, all the people here. That is, we are so grateful for what we have got. And what we are, our DNA really is something, it is not doing charity, but it is giving out of gratitude. And I think that is so unique. The concept of seva or seva bhav is really, I mean, I have had occasions to meet many global people, but here in India, I think all of us here feel that when we are doing something, it's what is the difference between charity and seva, or seva means service. The difference is that when a mother who's feeding her child, say in the middle of the night, and you know, there's so many times you have sleepless nights, but the mother, whilst feeding, does not feel that she's giving charity or spending time, but she feels that she is actually giving love and she gets happiness. I think that is the Indian diaspora, which feels happy by giving, and it's not, and we are grateful that we get an opportunity to do that. So with that as a beginning, I want to just bring to your attention today what's happening in India. In India, over the last several decades, the whole social sector has evolved. At the time of independence, we did not have any facilities. At the time when India got independent from the British, our average longevity was only 34 years, and literacy was about 17%. But now those things have all changed. Longevity is more than 70, literacy is almost 98%, and so on. So, and the government is today spending $500 billion a year in terms of the social space, whether it is in education, whether it is in health, whether it is in water, whether it's in other things. And the total CSR contribution, or what is the corporate social responsibility in India is only 6 billion. But the thing is, why are we not still making enough progress to alleviate poverty in so many parts of the country? So if I was to look at, if you were to draw an imaginary line in India, dividing India between east and west, and if you look at some parts of the east, forget the south, if you looked at the states of Bihar, Jharkhand, Orissa, Assam, Chhattisgarh, West Bengal, you'll find that the average per capita income of the West or the rest of India is 2.2 times, and these are really behind. And the only way I think we can work together is if we work along with government. In our experience, we've been working today for the last 16 years. We are working in the most challenging aspirational districts in tribal areas, and we found that if we work with government, you can get a leverage of maybe 15 to 20 times of what you're doing. And you know, very often people, we have this myth that government is corrupt, they don't want to do things. Actually, that's not really correct. Yes, there could be corrupt people, a few people, that can happen even in the private sector, we all know that, it can. But most of the people want to do something, and that's where you have to make the systems change. What is the change you want to make in systems? And we've done this, so I'm talking. One is, how can we decentralize power into what is the panchayat level, at the lowest level? How can we improve, whether it is in terms of using technology, what Sunil talked about, but how can you digitize data? How can you improve governance? How can you improve leadership capabilities of the people who are working and see that it's more inclusive? And this, I can tell you, we have been working and we found that it is very good. I'll give you just one example. We started working in the state of Rajasthan to improve the working in government schools alone, to see how we can improve the school learning levels in government schools. In the last 16 years, we found, and earlier Rajasthan used to be known as, I think you may have heard of the term Bimaru, which was like, you know, some states which were backward. But working with government, with the same staff, with the same teachers, today we found that in terms of the National Accreditation Survey and other international impact organizations, that it is the most improved state in terms of school learning levels. So it is possible to do that, and we have to work with government. We have to work in collaboration. I know so many of you have such good intentions of working, but it doesn't, I think, unless and until we work in collaboration, which is what we do. For instance, we work with the largest foundations in the world, whether it's the Gates Foundation and so many others, and we work with the local NGOs. How do we co-create solutions is what I would like you to consider, rather than just each one doing their own. You know, India doesn't need more schools, frankly. I think we need to see whatever our schools are they better run? We don't even need that many hospitals. How do you get better efficiency out of these hospitals? And that is, the resources are available. The government has actually got enough resources to invest in fixed assets, invest in salaries. But how do you make it more productive? And that is where the skills of people like all of you who've been so successful globally can help.
That's a very strong message. That's brilliant to think through the system, which not many people think. So that's a great thought and a great takeaway for our audience. Sunil, your foundation, I know you all are humble. You don't want to talk about yourself. Audience wants to know. So please share with us when, how, and where this thought of Wadhwani Foundation came and the work that you do.
Absolutely. Before I tell you anything about my foundation, Ajay, I'm going to embarrass you and reinforce what Ramola just mentioned, which is that we often hear in India over the last 20, 30 years, so much wealth has been created. But there are a fair number of people who've done well who aren't doing that much yet, at least visibly in terms of helping others. And Ajay, that's why what you're doing is so commendable. Not only is the work of Piramal Foundation large scale, having massive impact, but more than that, I think the example that you set for colleagues in India and all around the world, I think is absolutely amazing. People look at you and then they feel, yes, maybe we should do more. So thank you for everything that you're doing.
Sunil is a friend.
So for my own foundation, as I said, I've got my family has two different foundations in India. One in the public health space and one in the artificial intelligence space. And they are overlapping more and more. So I'm bringing those teams together. And so I'll just explain to you briefly what we're doing in my artificial intelligence foundation. I'll talk to you about how we are taking that work global, which is the theme of this discussion, and perhaps some broader lessons that can be drawn from that for all of the things that we're all doing. So in my AI foundation, as I said, it got set up 5 or 6 years ago because I could see firsthand these powerful technologies, but they were being applied only for commercial applications. So we set up this AI foundation in India, and we operate at 3 different levels. And by the way, at all these 3 levels, exactly to Ajay's point right now, we work hand in glove with government, both at the central level as well as at the state governments. Because when you look at topics like healthcare, education, agriculture, policies get done at the national level, but all of the implementation, execution is done at the state level. And when you're talking about transforming healthcare or education in underserved, in low-income communities, the only organization that has reach into these hundreds of thousands of villages is government. So for anyone who's serious about doing things on a large scale in any developing country, working with government really there is no other option. As Ajay said, it can be challenging, it can be frustrating, but it's something that you have to do. So in my AI foundation, we work first of all with the central ministries at a policy level. We have teams working in the Ministry of Electronics and IT, we have teams in the Health Ministry, Agriculture Ministry, Education Ministry, etc. And we help these ministries, first of all, we provide training on AI, what can it do, what can it not do, what kinds of data do you need, how do you develop data governance standards, how do you share data with other organizations, but in a way that protects privacy, confidentiality. So we're doing this advisory work, again, both at the central government level as well as at multiple states. We work with these ministries in coming up with the right use cases, meaning what are the right problems, national level problems, that fit in with national priorities of the government of India, but where there is data that's usable and where AI solutions might be appropriate. So once we identify these problem areas, then we have a team, like I said, of over 300 people that actually builds these AI solutions. So we've got at this stage over 25 AI platforms and solutions that we've developed in areas like tuberculosis, maternal and child health, improving farmers' incomes, early childhood education, etc. So as an example, for the government of India, 3 or 4 years back, TB became the #1 health priority. Tuberculosis is the #1 infectious disease killer in the world, kills close to 2 million people every year. And the 2 big challenges in TB, why it kills so many people, #1 is a challenge of early detection. It is still very challenging because, again, TB happens mainly in low-income communities. The traditional way of detecting TB is through an X-ray machine, etc. But in low-income communities, you don't have access to X-ray machines. If they're there, they tend to be broken. If they're not broken, they're not calibrated, etc. So the government said, can you come up with a way to help with this? So we've developed an AI application which can detect tuberculosis from the sound of a cough into a smartphone. Very challenging AI problem because, you know, all of us cough. In fact, I've got a bad cough right now. But a cough can be caused by 1,000 different medical conditions. And actually isolating what cough is caused by TB isn't easy, but we've developed the solution, it's been piloted, it's been proven. Now it is getting scaled across India through government clinics nationally. And the World Health Organization now wants to take this to Africa, and they're telling us this could be a game changer globally for TB. Second big problem in TB is there is a certain number of taking TB drugs. It's very tough on the body. These drugs are toxic, they create issues. So a fair number of TB patients tend to stop taking those drugs 1 or 2 months later. These people then develop what's called drug-resistant TB, and those people have a very high mortality rate. And in the process of this mortality, they will infect 10 or 20 other people. We've come up with an AI solution that can predict right in the beginning, as soon as a patient starts taking medication, we can predict which patients are likely to develop drug-resistant TB. So that the 2,000 TB caseworkers in all of India now are focusing their efforts only on these patients that we guide them to, so the effectiveness we get is a lot better. Another example, for over 1 billion people in India, when you get any illness, where you break a bone, you get a snake bite, you get a virus, your first stop is what's called a health and wellness center. There's 160,000 of these across India, and they are manned by a person called a CHO, a community health officer. This person is not a doctor, they are given some rudimentary training, and then they're expected to diagnose any patient that walks in. The government asked us a year back, can we develop an AI solution to help these community health officers do a better job of diagnosis? So we've come up with a system for them. It went into production about 6 months ago. It's already being used for over 400,000 medical consultations every day. It's the largest system that I know of anywhere in the world of this type. So now the accuracy of diagnosis is going up dramatically, the speed of diagnosis is going up dramatically, and then our system comes up with treatment plans and so on. We have similar applications in agriculture on how to improve farmers' incomes, on how to manage their crops better, how to manage pesticides better. In the field of education, again, the Education Ministry asked us a year back that in developing countries generally, not just in India, 70% of children in 5th grade cannot read a simple short paragraph in their mother tongue. So the government of Gujarat called us and said, look, can you help us with this? Because once you struggle to read in your mother tongue, it doesn't just affect one subject. It affects you in all of your subjects, and once you struggle in all of your subjects, then you're at very high risk of dropping out from school, and there's a very high dropout rate throughout the developing world. So we've developed an AI-based system that is now being used by all 3 million school children in the state of Gujarat, which assesses very quickly their reading fluency, assesses exactly where they're struggling, and it provides the teachers with individualized plans and programs on how to assist each child to read better. Government of India is now rolling that out in 10 states this year. Next year it'll go national. And we have interest coming in from around the world. So those are examples of the kinds of things that we're doing in India. So again, number one, we work at the policy level. Number two, we actually build these AI solutions. And then number three, we work very closely with state governments on deploying these solutions. And I'll tell you, the problem identification is maybe 10% of the challenge. Building the solution, the AI solution, is maybe 30% of the challenge. But 60% is deployment. And that is, I'll tell you, one big challenge most nonprofits have, not just in India, but around the world, which is everyone thinks of a good solution. Here's a non-invasive way of detecting breast cancer. Here's a way of, educating someone better. Very few people think through what it takes to actually get these solutions to work when you're talking about millions of people, tens of millions of people. How do you train a million frontline ASHA workers, the frontline healthcare workers, on how to use systems? It's not easy. How do you train 160,000 community health officers on using your system? Not easy, but you have to think about these things not after you've developed your solution, but on day one. And you have to work with government on developing how these will actually get deployed. So that's what's happening in India. And we're now in the process of taking these solutions into Africa and into Asia. We're setting up organizations in different countries in Africa and Asia. And hopefully we will start having impact on a much larger scale.
We would love to hear more because we can go on and on, but we have time constraints. But the most important thing that I've heard from both the panelists is using business strategies in philanthropy. This is a very impactful change. No nonprofit organization on the earth can do what these guys have started this is a new beginning, it's a new change, a very positive change, and we are so proud of both of you, and now we would like to hear from our third panelist, Bharat Desai. Please share your thoughts. I know you do a lot, I know you're from Miami and how much you do there. Share your thoughts on the impetus of Indians acting globally.
Sure. Can you hear me at the back? Yeah. Ajay and Sunil, really fantastic work. I really commend you for what you're doing, and all of us have so much to learn from you guys. So, you know, as an Indian who grew up in different parts of the world and had to migrate, I have a somewhat unique perspective on the impetus to act that I'd like to share with all of you. To provide the right context, I should probably give you a little bit of our family history and what we experienced and what my learnings were out of that. So, as I mentioned, I grew up in Kenya. At the age of 11, we were uprooted and had to move to India because there was political turmoil in Kenya. We went on a refugee ship from Mombasa, Kenya to Bombay. This was 1964. India was a young country, and I'm still stunned that with 500 million people and an under-resourced country, found it a priority to rescue a few hundred to maybe a couple of thousand people that were 2,500 miles away. Many of them who weren't even Indian citizens. You know, similarly, Nirja's dad grew up in what is now Pakistan, raised by a single mother, went to college in Lahore, and during independence, he moved to India. Their family was rehabilitated, and he went to settle down in Delhi and became a very successful economist around the world. But the question that kept bugging me was, why is it that Indians were exiled? And having lived there, I have a little bit of insight that I think I can share with you. The locals felt that Indians exploited their economy and didn't really invest in their development. And since we have people from 34 countries here, I just want to share the importance of integrating with your community and being viewed as individuals and families in a community that's very focused on raising the bar for all the local communities. Not only is it important for you, I think it's critical for your next generation and generations to come, because they will be viewed based on your commitment to that country. So I think for all of you, the learning that I'd like to share with you is get actively involved with your community and support them and help them thrive.
Thank you, Bharat. It's always so important to know where our roots are, what happened in the history of where we were, where our ancestors were, how they did. It's the same thing, you know, we are Sindhis and we have same story. We all have same stories to share, and our ancestors, you know, did what they did. And it's always a friendly reminder for all of us, at least especially for me, is always, if they could do it, why not? So whenever tumbling rocks come, you know, it's always that question and you keep going forward. So thank you for, you know, touching that point. And now, this is so amazing that I would like to ask all the panelists, how can this amazing Diaspora platform help you? What's your message for us? Because it's all about collaboration. this is a new beginning. What I'm hearing, what you all are doing is a new message even to the young generation, what the future will be. So please share your thoughts on that. Your message.
Yeah. I'm happy to go first. I think, we're, again, one of the experiences I've had is we had different communities around the world, but they acted as sort of small groups. I think Diaspora has provided a really great platform for Indians from around the world to come together, to share ideas and share learnings. And as important as this is for us, I personally believe it's really critical for generations to come. And I have first-hand evidence of this because whenever I go to an Diaspora conference, the input I get from a lot of the young generation is, we sorely missed and felt the lack of an identity. And I think as a community, it's important for us to come together and make sure that our generations to come feel bonded with each other and with our community.
Before you close, Bharat, one more question. Please share with us, I know you do a lot of philanthropy in India. It's important when you collaborate, everyone should know what more you do, and also you not only write checks at University of Miami, but you sit on the board and you serve and you do a lot of work with your lovely wife, Nija. So please share with us.
So, our family sponsored a urology institute at University of Miami. We saw urology as an area that was underserved in Miami, certainly, and we felt across the U.S. And we thought that there was an opportunity to commit resources and really advance the field. So in all projects that we do, we have a tracking mechanism to see what kind of impact our intervention is having. And this institute has done very well in the last 3 years that we've actually, since we launched it. It has 2 winners of the Global Golden Cytology Award, which is an award given maybe once a year to the best urologist in the world. So this institute has 2 of those. And they're working on several areas of research that could have breakthrough impact on the field of urology.
Thank you. Sunil?
Yeah, so to all of you, I just first of all want to say thank you. Everyone in this room is doing great work. I've been having so many conversations with so many of you at prior Diaspora get-togethers as well as yesterday and today. You're doing great things, so thank you for that. Number 2, I would say over the next 3 to 5 years, set your sights high, because whatever you're doing right now, just imagine the impact you can have if you aim to do 5x or 10x this amount 5 years from now. There's a lot of that we can learn from each other, and in fact there are organizations set up to do that. So in the US, as an example, we have an organization called the India Philanthropy Alliance, with about 20 different philanthropies that learn from each other in terms of how to operate, how to scale, etc. In India, Desai and others have similar things. So I'll close by saying the following, and this goes to MR, Sanjeev, and the Diaspora team. Right now, I know we do a survey measuring how much the Indian diaspora gives in the way of social giving, charity. I would say if you can take it one step beyond that to assess the impact we're having, whether it's in terms of jobs created, whether it's in terms of healthcare improved, education, etc., I think that gives a much more holistic picture of kind of the contributions of the community. And then let's set a goal between now, 2025, year 2030, 5 years from now, can we increase that impact by 10x? Not by 2x or 3x, but by 10x. And in this day, with the force multiplier of technology and AI, I truly believe that's possible. So think of how transformational the Indian diaspora community can be if we take on that kind of challenge.
I'm just going to take off from where Sunil said. One thing I would say is that, first of all, as I said, to solve the issues, let's work together collectively. People can all, very often it feels that I will not get credit. I think there are ways to everyone to get credit as well and to make a significant impact. And I think I'm also learning from what Sunil does, actually spends a lot of time going to see in parts of India where what they are doing, is it making a difference? I think when you go and see it's one thing to give funds, which is absolutely important, but otherwise when you go and see, is it working, that will give you another level of satisfaction. I can guarantee you that. And one last point I just want to make is, let us all learn from nature. Nature is one thing that is giving us everything free. The soil you have, that's where the food grows. The water, the rain gives you water. And the air, you realize the importance of nature when during COVID, people were grasping for oxygen and we take it for granted. I know that there were the richest people wanting to get a little bit of oxygen. So let us now give back to nature what we are consuming all the time. Can we do a little more so that the world is a little better place around us when we leave this world than when we came in?
Ladies and gentlemen, these three panelists need a standing ovation. They are living their legacy. They are example for us. They are example for the world globally. It's amazing. Thank you so much, gentlemen. Thank you, all of you.